much weight they gain.
So I need to have you step up on the scale for me, please.
How much weight should you gain? Well, that depends on where you started. Doctors usually recommend a gain of 25 to 35 pounds for women who are not overweight or underweight. Your personal weight gain goal is something to work out with the doctor or nurse midwife. Some women have trouble getting enough of certain food groups. For example, they're lactose intolerant and can't have milk products. Vitamin and mineral supplements can help fill the gaps there. In fact, many women are prescribed a multivitamin from the beginning of their pregnancy to make sure the baby gets the essential vitamins and minerals.
Iron is important for women as well as calcium because we know that the baby will drain her supply of iron and calcium.
The placenta will look around for a source of calcium. If the mother's not eating enough calcium, for example, then the only other choice the placenta has is to get calcium from the bones of the mother.
Many doctors urge women to take multivitamins even before conceiving, especially because of the importance of folic acid.
Folic acid has clearly been shown to decrease by 50% the risk of certain birth defects, particularly spina bifida or neural tube defects, which are openings in the baby's spinal canal.
Now, some vitamins, such as vitamin A, have been proven harmful in high dosages. So you should get advice from a healthcare professional about any vitamin supplement you're considering. Certainly avoid any that are not labeled for prenatal use.
The list of what to avoid during pregnancy generally includes things that are bad for you. They can cross the placenta and damage the fetus. If you haven't stopped smoking yet, now's the time. And secondhand smoke from anyone in the household could also threaten the development of your baby. Regular alcohol use during pregnancy is a known cause of fetal alcohol syndrome, associated with impaired speech and motor skills, lower intelligence, and increased risk of premature death of the baby. While it's not certain whether one drink now and then will hurt the baby, most doctors say, play it safe. Don't drink alcohol at all.
It would be nice if we could tell patients that, an occasional glass of wine is safe or that 2 ounces of alcohol is safe. But the fact of the matter is that we don't know what a safe level of alcohol consumption is.
This is a subject you should talk over with your healthcare provider. At the same time, ask about guidelines for caffeine, which tend to vary. Many prescription drugs and over-the-counter medications can harm the fetus. You should discuss taking any medication with the doctor or nurse midwife supervising your care. While certain conditions require medication, this is a time for trying alternatives. And fathers can help. Try bringing her a wet washcloth for a headache. Later, when leg cramps are often a problem, a massage might do wonders.
You can both be on the lookout for other hazards to the baby. Read labels on household products that may contain harmful chemicals. Don't handle cat litter. It's a source of a disease called toxoplasmosis that can harm the fetus. And avoid raw or undercooked meats, fish and poultry, and unpasteurized dairy products. What not to avoid? Exercise.
At the beginning of the pregnancy, for the first 2 trimesters, unless there are other complications and problems, I tell the new mothers, just to exercise regularly like they have been doing previously.
However, if she has not been in the habit of exercising prior to pregnancy, I would recommend that she consult her doctor.
There's another kind of exercise your doctor or nurse midwife might recommend to help with the embarrassing problem of leaking urine. It's called a Kegel. You contract the muscles surrounding the urethra, vagina, and anus for about 10 seconds. Frequent Kegel exercises may strengthen these muscles, which can help during childbirth as well as with urine control. There are also some coping strategies for morning sickness. Studies find 70% of pregnant women feel nauseated until about the 12th week. With severe nausea and vomiting, you should call your doctor or nurse midwife. But most women get through the early weeks by adjusting their eating habits.
Have crackers, have bread, plain toast. And if that works for you, great. But if you're sitting there and the only thing you can imagine eating is a burrito, try it.
Being nauseated and later being large may require some adjustments in your sex life. But being pregnant does not mean you have to stop having sex.
Sex is absolutely fine as long as there aren't any complications during the pregnancy.
It may help, however, to be sensitive to how the woman's body changes are affecting both of you.
Some women may be surprised that how fast their body changes and how they lose their figure. I know that I was.
The more you learn about the very normal process of pregnancy, the better you'll be able to enjoy this exciting phase of your life. And we can't advocate any one approach to health care during pregnancy and the delivery of your baby, but we can urge you to seek out the many excellent books that can provide more information on these issues and much more. We'll talk about some of the issues that will come up in the months ahead next.
Report 4. Issues and answers.
By asking questions and discussing things, you give your doctor a better understanding of your specific concerns, and that's important. Do not hesitate to ask questions. In fact, it might help to write them down beforehand. You are not the first person in your situation to have those questions, and you won't be the last.
The doctor could be a little intimidating in that he would have his folder, my folder, under his arm or my file under his arm, ready to, any questions, and like he felt like, oh, I'm taking up his time, and I would try to. That's why I started bringing my little list with me every visit when I had a question, because I think it made him stop and realize I was serious about asking him a question.
That was a good move. Couples do have a lot of questions when they find out they're expecting.
You have the questions, but how do you feel comfortable enough with your doctor to talk about everything that's on your mind? Well, to help you with that problem, we have with us Dr. Ron Jekyll, Assistant Professor of Obstetrics and Gynecology at the State University of New York at Stony Brook. Welcome, Dr.